I'm here today with Lara Mathers, who is an accredited fertility and pregnancy dietitian. I'm really excited for the conversation because there's so much information out there around fertility and nutrition. And right now, frequently, I am often asked questions surrounding this. And look, the women I see are really trying to do the right thing, but they don't actually know what matters. So today we're going to strip it back. We're going to strip it back to talk about what is really important surrounding fertility and nutrition and what women actually need to be focusing on when it comes to supporting their own bodies, to prepare them for being pregnant, to prepare them for everything, for later life as well. So Lara, I'm going to start by asking a common question. There is so much information out there on wellness and fertility and egg quality and what we know women can do with their diet. What is actually evidence-based and what is just wellness noise?
It's such a good question, and something that I always start with for clients is talking about the Mediterranean diet. And the Mediterranean diet does differ a little bit from, I guess, the standard Australian diet. So in the Mediterranean diet, there's a big focus on fish as your source of protein or your white meat, lots of colours of vegetables fruits and vegetables, and then healthy fats from olive oil and nuts and seeds. But focusing on your diet on the Mediterranean pattern can increase your chances of pregnancy and also improve your fertility outcomes by about 21%.
That is mind-blowing. That's mind-blowing.
Yeah. It's a really well-researched dietary pattern for fertility, and it's an easy one to adopt over time. And then if we're talking primarily pregnancy and IVF, so in the 2-week wait, there is evidence to say that if you are getting your serves of whole grains, so whole grains are foods like rolled oats, quinoa. So if we're getting 4 serves of those every single day, which is not a huge amount, it's about 1/4 cup of oats, 1 slice of a really whole grainy bread, that each of those are 1 serve, so 4 serves of whole grains. And if you're having beetroot juice, your chances of improving implantation is about 23%, sorry.
Again, amazing.
Yeah.
What advice do you give to someone who might be, just for example, Southeast Asian origin as far as the tricky Mediterranean diet goes? How would you modify it?
I would definitely try and get them to incorporate as much seafood as they can. So I guess in the Asian cultures, they eat a lot of red meat, potentially fatty red meat. So trying to shift some of their traditional soups and stir-fry dishes that they eat, and then just bumping up their colours. So I try and tell people to have 3 different colours at lunch and dinner if you can. So tomato is red. Yep.
Carrot.
Yep, is another colour. And broccoli is
okay. I actually feel vindicated now because I like to serve very colourful dinners, mainly to make it look attractive, but I didn't know that there was actually some science behind it.
Yeah. Well, if you're working on that principle, even at breakfast, if you're on the weekend having a cooked breakfast, if you're getting 3 colours in 3 times a day, you are exponentially increasing your load of antioxidants.
And antioxidants are fabulous. Antioxidants are fantastic for women and actually for men, for sperm production.
Absolutely. Yeah. It just decreases all the sources of inflammation that we can get from everyday life, from stress, from pollution, from aging, all those kinds of things. So the antioxidants help with decreasing all of that.
And do you recommend supplements that... How do you feel about supplements on top of a balanced diet? Where do you stand with that?
I really like supplements. I'm somebody that I like so they have to be very prescriptive to a person. So if you have PCOS, then, I would suggest using things like a myo-inositol, and sometimes we might add in other things, CoQ10, vitamin E, vitamin C, if you have endometriosis, all those kinds of antioxidants in the form of supplements can be really helpful for fertility, for pregnancy, for reproductive conditions.
Okay, what do you say? So I'm often asked, I am a big fan of egg freezing. I think it is an amazing opportunity for women to take control of their own fertility. But women will often come in and say, I want to maximise my health before I do this. And my advice would be whatever we say to women who are trying to get pregnant, we actually should apply the same to women who are looking at egg freezing. But this woman doesn't want to get pregnant straight away.
Yep.
It's not like she's going to be trying right now. So we've got 3 months.
Yep.
What do you say?
I would say that you need to up-level your diet as much as you can. So your foundations are your nutrition, your everyday nutrition, so Mediterranean diet, as much as we can. And then I would be adding in those egg quality supplements like CoQ10, making sure you're having the right dose. Then there is the option of NRC or NMN, which has recently been TGA approved in Australia, and whatever else.
You're using some letters. Do you want to just expand on that?
So NRC and NMN are 2 very long words, but they both increase what we call the NAD plus levels in our body. And those are, I guess, energy levels that, eggs need a lot of energy. And as we get older, some of those energy levels can decline. I talk about it a bit like a battery life. Okay. So I would be...
So we're going to become ever-ready batteries.
Well, certainly if you're putting some eggs in a freezer, you want them to have great potential because, you have a window of opportunity. You have that 90 days where you can provide a supportive environment for your eggs with nourishing food, with the right antioxidants, good sleep, limiting or avoiding alcohol, not smoking.
Yeah.
All of those high quality lifestyle factors.
Okay, what do you say to the woman who has been having problems, has been trying to fall pregnant and hasn't been successful? It's been 6 months, but she's not ready to do anything really interventional such as IVF. What do you say to that woman?
In terms of nutrition,
implantation and everything afterwards.
So she's not ready to do IVF. We obviously, if she's seen a specialist or seen a doctor and had any diagnosis of reproductive conditions, I would be, if, for example, it's PCOS, then I would be trying to target her dietary pattern to help her be ovulating every month, and then using the supplements that we use in PCOS again. So inflammation is a large factor in PCOS, and that insulin resistance. So the myo-inositol, omega-3s and CoQ10 can be very helpful. If there's no underlying reproductive conditions, I would be working with a woman to get some very good foundational nutrient levels. So making sure their vitamin B12 level is not just okay and not just adequate, but it needs to be optimal.
Yeah.
Similarly, vitamin D, we know that vitamin D levels need to be at 75 to 100, which is, 50 is what everyone says you're good to go. So we need to be doubling those levels because we know that they have improved outcomes with pregnancy and reproductive health. So, I'd be doing some detailed nutrient testing and then supporting this person to minimise her stress, get into a good routine of exercise and good sleep.
Okay, the next one is the woman who is doing IVF. Do you give her any different advice?
So I would certainly get some excellent nutrient levels tested the same. We want to be targeting those optimal levels. And
so what you're saying, you'd be a little bit more interventional now.
Interventional, yeah. So I would probably, I'd be making sure that she was following the Mediterranean dietary pattern, but also making sure she was having enough protein at the 3 meals she was having every day, because we know that a lot of women are not having enough quality protein, and that supports optimal blood sugar stability, which has a flow-on effect for metabolic health. And if she's doing IVF, I'd be going quite targeted with a supplement regime, working with a fertility specialist like yourself to include the antioxidants that we know are evidence-based, so CoQ10, the NMN, omega-3, and then I believe specialists like yourself may use things like melatonin.
Melatonin has got antioxidant activity. I just love everything that you're saying. It's great because there's obviously a lot of science in IVF and fertility IVF. It's what I do, but there's so much more to preparing your body and also preparing it for pregnancy as well.
Yeah.
I'm going to ask a really difficult question. The woman who is obese, who comes in, let's say she's 40 and she's obese and she's trying to get pregnant. This is a really hard one because you haven't always got 6 or 12 months to really optimise your health, but it's so important, and weight is so important.
It is. I have had clients like this, and if the specialist and the patient is open to it, I am a big advocate for using medication like the GLP-1s. So, for example, that's Ozempic, Wegovy, Mounjaro. Obviously, we need expert medical support when they're used, but if you have a bit of a timeline or a deadline, the metabolic benefits that come with the GLP-1s, and then if you are working with a dietitian,
it's everything, isn't it? You can't rely on that alone.
No.
You need to address diet and exercise.
Yeah.
And also for women to be aware that when they're on it, when they stop, they've got 3 months before they can start to fall pregnant. That's the current recommendations.
Yeah. So they take it in the lead up. So we optimise you metabolically through the correct nutrition, making sure you're not skimping on nutrients, which can be obviously a big risk factor when you're using medication to reduce appetite. But it can be done well in the right sort of situation.
Yeah. No, in like a supportive environment.
Exactly.
And for a woman who it's very targeted.
Yeah.
And
because we know that if you are very overweight or obese, the level of insulin resistance is going to be...
It's going to affect ovulation.
Yeah.
But I think we forget that we want to set these women up to have a healthy pregnancy as well.
Yeah, all of those pregnancy risks that come with metabolic challenges.
I see a lot of women with pain, with painful periods. I see a lot of women who have been told it's just normal, forget about it. I think we have, this is the expression I use, I think we've gaslit young women for too long to say it's nothing, just get on with it. And these women have often got endometriosis. The gold standard, of course, is to do a laparoscopy to remove it, but there's so much more that comes as a part of that, and diet and managing pain. That's also something that I'm often asked about.
Yeah.
What can I do to minimise the risk of this coming back? I'm going to answer my own question, but then I'm going to leave it on to you. A simple thing I would say is that, you know, they've shown that having an estrogen-rich diet is bad, but you would have to have extraordinary amounts of soy milk for that to be an issue.
Yes.
So I'm leaning towards talking about, an anti-inflammatory diet. What is that? Talk me through that.
So with endometriosis, we know that taking snippets from the Mediterranean diet, so lots of colours, using only extra virgin olive oil, so really limiting your sources of trans fats and saturated fats. So trans fats we're lucky in Australia, they're very limited because the government regulates that. But saturated fat is, fat on meat and the fat in baked foods and chips and things. So keeping those levels down. And then we know that cruciferous vegetables.
Okay. Please explain. I think there might be someone who is very well known for using that expression.
So along with this anti-inflammatory diet, there are 2 vegetable families, let's say, that have been shown to help with estrogen, let's call it excretion.
Right.
So
I love this.
Yeah, cruciferous family includes broccoli, cabbage, Brussels sprouts, not everyone's favourite, bok choy and cabbage, and then mushrooms. So the cruciferous family, they help bind estrogen. So there's a really long word called indole-3 carbon, and that helps to bind excess estrogen that might be circulating in the gut. And instead of it being recirculated into your bloodstream, then when you have a bowel motion, it's gone.
All right.
And mushrooms are natural aromatase inhibitors.
Okay, I've really learnt something today.
Yeah, so I always tell my clients who are trying to manage their endometriosis holistically to have lots of cruciferous family vegetables, and mushrooms, try and incorporate them as much as you can as well.
I'm just going to circle back to something that you were just talking about with mushrooms. I really like mushrooms. I can say that my little girl doesn't like mushrooms, but there you go, they're aromatase inhibitors.
Yeah.
And just to recap, just to expand, aromatase inhibitor it's going to block an enzyme which leads to estrogen production. So it's going to have really benefits for women who have got endometriosis.
Yep.
Okay, now I'm going to ask a question completely different. Can you tell me about the vaginal microbiome and its connection to fertility? This has received a lot of airtime just recently.
Yeah, it has. And I think it will continue to grow. So we have a microbiome in our uterus and our vagina. Most people know that we have only a gut microbiome. But there is bacteria, good and bad, that live in both the vagina and the uterine microbiome. And both, well, let's talk about the vaginal microbiome, but we know that a healthy vaginal microbiome has a larger proportion of Lactobacillus crispatus, and that is a very protective bacteria. And we know that women who have more of it are more likely to have successful implantation. That bacteria also inhibits the uterus in the the uterine microbiome there as well. So we know that multiple courses of antibiotics, things like bacterial vaginosis, which are, common things that women experience, unfortunately, they can disrupt a healthy vaginal microbiome. So we can work nutritionally, we can work with specialists for the correct antibiotics, and then there are strain-specific probiotics that we can take orally, and then some are prescribed internally to restore a healthy microbiome that's got that good Lactobacillus crispatus. So there's some IVF studies being done. There's been one in Italy, and I think we will see more and more in the future.
So I will quite often recommend a probiotic.
Yep.
And this is a little bit off the topic of fertility, but in women who have got, a lot of discharge, I always say you knock it on the head with the right antibiotic, depending on what it is, but then you've got to do something to stop it coming back.
Absolutely.
And you've got to avoid over-processed carbohydrates.
Yep.
And a probiotic.
Yeah, and we know that fermentable foods, which are things like sauerkraut, kimchi, kefir, they are also very helpful in restoring the microbiomes, so gut, uterine and vaginal, after proper antibiotics. So yes, like you said, you've got to treat it, but you've got to repopulate it in the same sort of time period.
Yeah. Okay, I'm going to ask a more general question now. And this is going to apply to a lot of the women, a lot of the people listening. What would be the general advice that you would just give for nutrition for someone in their everyday life?
Their everyday
what are the
life.
basics?
Yeah, I would make sure that you're having 3 solid meals a day. I see a lot of women who are skipping breakfast or intermittent fasting and just not nourishing and fueling themselves properly, which we know can obviously lead into period issues. But 3 solid meals, try and have a couple of pieces of fruit, those 3 colours on at least lunch and dinner. And I'm a big advocate for dairy products like yogurt and milk and cheese. I know there's a lot of alternatives out there, but I like the good old-fashioned stuff. And we know that the evidence for bone health, which is really important for women, is all on cow's milk.
So not almond milk, not soy milk. I'm just asking.
Yeah, the evidence for, bone health, it needs to have the calcium in it, and a lot of the almond milks, they don't have added calcium. Soy milk, yes, they do often have added calcium. We know that from an ovulatory perspective, so that means like regular ovulation, like monthly ovulation, that people who were proper cow's milk dairy consumers were more likely to have very regular ovulation. The people who drink alternative milks have anovulatory, so not very regular ovulatory cycles. If you can't tolerate it, then obviously make sure that you are choosing a form that has some added calcium or some vitamins like B12. So there are vegans out there that obviously do drink almond milk or oat milk, and so then I would advise them to check for the fortifications.
Thank you for sharing all of that. There's going to be a lot of women out there who are going to take all of that on board. All right. Do you have a question for me?
Yeah, I do. I have a question for you, Jenny. So I see in my work women who have unexplained infertility a lot of the time, and they might be mid-30s, sometimes a bit younger, and they often get pushed to IVF without proper investigation. And for me, it's quite easy to ask a couple of questions about period pain, constipation, all those kinds of things, and it makes me think about endometriosis. So what are the statistics? Why? What can I help? How can we help these women advocate for themselves better?
That is an amazing question. I believe in a young woman in her 20s or early 30s, with good ovarian reserve, regular cycles, and where the partner has normal semen analysis, they really should get pregnant. And I don't believe that unexplained infertility is a part of that group. After the age of 35, sure, you're starting to talk about egg quality and that comes into play. But we talk about this concept of silent endometriosis. It's not really silent. If it's stopping a woman falling pregnant, it's actually loud and clear.
Yeah.
But there are many women I see who don't have pain with their periods. They don't have pain when they ovulate. They don't have pain when they have sex. They just can't get pregnant.
Yep.
Some of them might have some spotting before a period starts. And yes, they've been signed up for IVF, which has failed, and then signed up for another one, which has failed. And at some point you just have to press stop and say that these women need to be investigated properly. They need a laparoscopy by someone who knows endometriosis, and they need a definitive excision of endometriosis. They may not need IVF. A lot of these women have been led to believe they need IVF to get pregnant, and for them to fall pregnant afterwards naturally, it's just not something they've been told. How can these women advocate for themselves? It's to find someone. Look, I would be one of the few people who I'm passionate about fertility. I do IVF and I also do laparoscopy for endometriosis. It's to find someone who knows fertility and who knows endometriosis, who is actually looking at the whole person and addressing all of it. And it's amazing that on top of everything else you're doing, looking at the diet, looking at their lifestyle and exercise, you're actually thinking, what else is going on? Have you got endometriosis? And you've certainly sent some ladies along.
Yeah. So it's helping them find the right person then, I guess, asking for that second opinion.
To know that it's okay to look outside the square and to ask questions and to ask a second opinion. If they're not getting it where they are, then look further.
Yeah, look further.
Yeah.
Yep, thank you.
So raw versus cooked.
In what sense, like nutritionally?
Cooked food is like it tastes a lot nicer.
Yeah.
But I always have this idea when I, cut up carrots and tomatoes and whatever and make a really colourful salad, it seems to be more healthy than if I've, steamed something.
Yeah.
And I never boil anything.
Yeah. Well, the cooking method does change the nutritional value of the vegetable. So I guess you can certainly overcook things and they will lose some of their what we call heat sensitive or water soluble vitamins, which include, vitamin C, which is a really big antioxidant. So you have to be mindful of overcooking, boiling, because it just goes in the water.
Squeeze a bit of lemon juice over it.
So a mixture of both.
Okay.
I suggest.
So Lara, I'm just going to ask you to expand a little bit more, just to circle back into something that you said. You would highly recommend, that women, adequate nutrition means 3 meals a day, and you do not agree with intermittent fasting.
Yeah.
But that's been out there and that's popular and a lot of people do it.
Yeah. So what we're learning really is that most of the data is in intermittent fasting is done on men and not women.
Oh, okay.
And women in their reproductive years are very different, again, to women not in their reproductive years. So intermittent fasting can certainly do more harm than good. And if you were to do some kind of intermittent fasting, biologically, what's better for our body is to have bigger meals, morning, lunch, and a smaller, afternoon meal. So you would have a longer period of fasting when you're sleeping to allow your...
So it's sort of like a natural intermittent fasting.
But people fast till midday and then do it the other way around, which to me just doesn't really work very well.
Yeah, but the difficulty, I suppose, is that our lives are set up that we get up, we go to work.
Yeah.
We don't have siesta or anything in the middle of the day. It's not Spain.
Yeah.
And I think that's got a lot going for it, just to chill out in the middle of the day. But we don't do that. But it means that we're not near home during the day.
Yeah.
We'll grab a sandwich or whatever, and then you come home and you've not really eaten that much during the day, and you have your big meal, then you go to bed.
Yep, exactly. It's, I think having a big meal at the beginning of the day and a small meal at the end of the day is not common in our Western society. It's very difficult. But if you are looking to pursue intermittent fasting, that really is the safest form, especially if you are in your reproductive years.
I'm also asked, what can I do, just to minimise the chance that I'm going to have episodes of pain. And I mean, I'll answer my own question, then I'll put it over to you, Lara. So I recommend an anti-inflammatory diet, and for me that involves turmeric, big fan of turmeric, and avoiding acidic and spicy foods. And women's pain can be a lot better just with those simple measures. And I'm not saying that is fixing the endometriosis, but It's part of the armamentarium.
Yes,
Yeah.
absolutely. And things like turmeric are very helpful in reducing pain mediators, and other things like vitamin E and vitamin C have been studied in reasonably high doses in terms of reducing pain, pelvic pain as well.
And what food source has vitamin E?
Vitamin E is avocado, seeds, sunflower seeds, nuts.
Okay.
Yeah.
I always, the nurses at work laugh about this. If they want me to go in because they want to ask me a question and it's a way of getting my attention, they buy me nuts. And we have a nut cupboard. In fact, we've just renovated the area and my main concern was, where will the nuts go?
Where will the nuts go? Well, nuts are such a superfood. They've got zinc, they've got healthy fats, they've got vitamin E, they've got fibre. For men, the dosage is about 75 grams, which is, a solid handful of walnuts. Increases sperm motility and morphology. And I can't tell you by how much, but...
So I tell men to take antioxidants, Menavit coenzyme Q10, extra green vegetables, and a handful of walnuts per day.
Yeah.
Now, clearly that's not going to work if they've got a nut allergy.
Yeah.
Yeah.
Walnuts are good for your swimmers.
All right. So, Lara, this has been an absolute pleasure to talk to you today, to really focus a lot of light on something that is so important that we haven't focused enough light on up to date. Thank you for that.
Pleasure.
It's been an amazing time talking to you.
Yeah, it's been wonderful. Thank you for having me.